Welcome into another edition of the Advancement Interview Series. We have done a couple episodes now, and we've been really fortunate to have some great members of the Baylor community with us, and today is no exception. I'm really thrilled to have Dr. Karen Cotter on our interview series. She is the Associate Dean for Pre-Licensure Programs and a Clinical Assistant Professor in the Louise Herrington School of Nursing here at Baylor University. Dr. Cotter, I really appreciate you taking some time to talk today.
Thanks. I'm happy to be here.
So the first thing I wanted to give you an opportunity to do is just speak briefly about your background in the field of nursing and obviously your time at Baylor. I know you've been in the role you're in now. You told me for about a year or so. Just a kind of a quick update on yourself for the people that are listening in.
Sure. I've been a registered nurse for just about 26 years now. I earned my bachelor's degree in nursing, and I hold a Master of Science and a PhD, both of which I studied nursing education. So I've spent about 20 years of my nursing career actually in the classroom. I came to Baylor about 3 years ago in a full-time faculty role to teach here. It was a mid-career change and kind of a leap of faith to change schools. I was in a tenured position at the university where I had been teaching for 14 years. And I have to say Baylor has felt like home since the first day I stepped on campus. I taught my first year and was assigned to be the undergraduate program director in mid-year of my second year of being on the faculty at Baylor. And then this past summer, I was appointed to be the Associate Dean of Pre-Licensure Programs. I've loved my time in this position. I feel like the 20 years I spent in my career getting to this point really has prepared me well for to oversee and direct all levels of our undergraduate program. We have 3 tracks in our undergraduate program. We have a traditional BSN, which our students are at Baylor Waco for 2 years, and then they come up to the Dallas campus for the 2 years of the professional program. And we have an accelerated program face-to-face where students can earn their BSN in about 12 months. So they spend a year at the Baylor School of Nursing and finish and are eligible to take the registered nurse license exam. And then in the fall, we're launching our 3rd track, which will be an accelerated program for distance students. So it'll be delivered completely online with the exception of 2 weeks that they come to our campus for some lab work and to get to know the faculty face-to-face. It's an exciting time at Louise Herrington, and I'm looking forward to the future and influence of Baylor nursing across the region and indeed the country and the world as we go forward. So.
Yeah, that's excellent. I appreciate it. And Dr. Cotter, you mentioned, the new program that's coming in the fall, which will have that online component. I was curious, a lot of our our alumni and friends and parents that I work with, they do have a lot of questions about the student experience right now, and managing that with the coronavirus and some of the things we're facing. So I was curious about how learning has kind of changed and been challenging in a hands-on field like nursing.
Sure. In nursing education, we generally learn about disease processes coupled with the nursing care that goes along with them, like how do you help a patient with pneumonia, what interventions might help them breathe better. We work on what can facilitate the patient's recovery from their illness, what can facilitate their comfort in times of recovery is not possible. Each course along the way is paired with a clinical course. So if you're learning about adult disease processes, you'll have a clinical experience where you learn about where you take care of those adult patients in the hospital setting. And so to take it all online and be teaching the content across a different medium where you can't be with those students in the classroom and have those questions asked directly. It was a challenge to put it all online in a hurry.
Yeah.
We're planning for our online program and we've been developing the courses for a number of months now, but to say, okay, now all you face-to-face students, we're now online, and it's been a challenge, but I'll say my faculty have really risen to the challenge, and we're in our final week of classes now, and the students are doing well, and they've adapted well. We have some plans to make up clinical hours when we are able to gather back together again in the fall for our students that are going to be in the second and third semesters of the program. The governor gave us permission to substitute clinical experiences this spring for graduating students. So not being able to be in the hospitals has not impacted their ability to finish the program. But we implemented a lot of virtual clinical experiences for them, and 10 different experiences which were to substitute for the 10 shifts they might have spent with a registered nurse working those 12-hour days, because we had some concerns with them finishing their clinical hours. In early March, we started getting emails from our clinical agencies saying, we're not going to be able to have your students here because of safety and our staff and the lack of PPE and things like that. So we started working in early March trying to figure out what alternative experiences could we give to them. So it's been challenging. I actually was on a student interview with a student applying for one of our summer programs, and she actually cited a clinical experience that she had on a simulated clinical day, which through some of our virtual clinical experiences, that was so meaningful to her that she remembered, oh, we figured out this patient couldn't breathe well, and we were able to make this intervention and think through that problem. Even though she wasn't actually with the patient, we were able to make it real enough to her that she had a good, memorable learning experience from it.
Wow, that's a really cool example, and it's a great segue into the next thing I was just going to ask. And I know you kind of touched on this a little bit, but it sounds as though the students are adjusting as well as can be expected at this time.
Yeah, I would say it's been a challenge for them. Many of our students take advantage of our academic building in Dallas to has lots of nice study spaces and study rooms for them to work together with whiteboards on the wall and study in groups and things like that. And we haven't been able to let them have access to that building. So I think that's been challenging for them. Our student services staff has done an outstanding job of keeping in touch with students. They have a daily Instagram meeting with them. They call it Instagram and Coffee, and it's just for 15 minutes every morning at 9 o'clock, where our student services director and her staff take turns leading just a conversation about what's happening at the School of Nursing and what challenges are they having. I was invited to be a guest one morning, and I had to create an Instagram account to do it. I had no idea, I'm not exactly in the young generation anymore. So figuring out how to, but it's fun to watch that, and you can see it every day. And I don't always get a chance to interact with them, but to know that we're trying to maintain some sense of community, because they are all apart, and some of them are across the country because they never came back after spring break. And but we've been able to facilitate completion of their courses and successful completion. And I know there was a lot of anxiety at the beginning, but I would say all in all, they've adjusted pretty well.
Fantastic. Again, I'm talking with Dr. Karen Cotter, who is the Associate Dean for Pre-Licensure Programs and also a Clinical Assistant Professor in the Louise Herrington School of Nursing. Dr. Cotter, what are you hearing from students right now? I guess specifically those that are kind of at the end of the educational experience that are ready to move into the industry. What are you hearing from them kind of as they try to do that during this pandemic?
Yeah, a lot of our graduating seniors do have professional positions already. They start that interviewing process usually in January if they're graduating in May.
Okay.
And many more are actively interviewing. We actually have about 200 students that'll be graduating this month that are finishing up our entire program, because our traditional track and our fast baccalaureate track both finish in the May cohort. And I think there's a mix of anxiety among the students. That they're excited to be done with the program. They're disappointed that they're not going to have the recognition of pinning and graduation and everything right now, at least as a whole group together. And we're working on some alternatives to recognize them virtually. But they're eager to be part of the workforce that's being recognized right now as being, putting themselves at risk, and that heroic nature of view of what nursing is right now. But I think they're nervous about being exposed to those very vulnerable patients, but certainly they are excited to look forward to taking on those roles. It's been, disappointing, I think, for them not to have their final semester as part of that community, of our nursing school community, but I think they're excited, I would say, and nervous at the same time.
Sure, sure. Well, and it's incredible to think about, 200-ish, Baylor students about ready to jump into, kind of, maybe they won't all be in the exact role, of course, but right into that kind of frontline position is amazing. And we're blessed to be able to, have great students to do that. Those 200 students and the others, in the program, maybe not making the immediate impact right now on this fight against coronavirus. But one thing that the nursing school did as a whole, Dr. Cotter, was provide a PPE donation. I think it was in March that donation was made. And I wanted to give you a chance to kind of speak to that decision and the impact that that's having as well.
Dean Conroy actually had read online that other programs across the country were figuring out how to contribute to the effort by collecting and donating essential supplies to their partnering hospitals. So we reached out to our closest partnering hospital, which is Baylor University Medical Center, and said, what do you need? What can we do? We can't bring our students to you, but what can we do to support your frontline defenses? And our lab director, Jeannie Carey, facilitated collecting supplies that we had in our laboratories that we had used. Personal protective equipment, where we had taught the students, in the spring semester, how to don the protective equipment and then, use it to care for patients. Yeah. So we were actually able to donate probably the back of an SUV full. So in the pictures I saw of the equipment that they, several hundred surgical masks with ties, and then procedure masks, the ones that you see everyone wearing now with the ear loops, about 1,500 of those. And then the face shields that you see people wearing that are plastic that sort of cover the entire face. And that was probably the lowest number, because we don't use those in our labs because our plastic mannequins usually aren't expelling respiratory secretions on the students, so we don't have to worry about that. But she said he was very excited about those because those are the things that were in the shortest supply at the time. That was around the March 23rd or so, that last week of March. Yeah. So we gave him some hand foam, isolation gowns, and then gloves.
Incredible, example of generosity, and that's fantastic. Another example of that, Dr. Cotter, was just maybe a week or two ago. There was an article that was put out by Baylor talking about one specific alum, which of course is one of many alums, but Deborah Tzvetz, who is a nursing grad who went from Texas to New York to be front lines to help fight this coronavirus. And it was really in a kind of an amazing alumni spotlight. And again, that's one of many, many examples. So I just wanted to kind of get your take on, maybe some of the alums you're in touch with, and just some of the impacts that you're hearing of from the Baylor community probably around the world.
Yeah, I saw that article too. I was following some of the comments on Facebook and hearing and watching a lot of Baylor alums across the country respond to that article and, talk about being proud to be a Bear and being part of this larger community of influence in this larger community that's really coming to the forefront of the public's attention. I hope we hear more stories like these in the days and weeks and months to come. I think I heard some stories today from someone in Detroit, and I can't think of her name right off the top of my head, but the challenges that are unanticipated with the presence of COVID in terms of a family having to change their approach to her work schedule because because a family member that didn't become ill, but was exposed to a great number of COVID patients, so couldn't be in their home at the time, and how that influenced their overall life. There's a lot of unanticipated consequences of COVID-19 that I think will come out in the coming weeks and months as our recent graduates encounter the challenges of being a new nurse among this army of providers. And I would like to know more about how other service professions with roots at BU are serving in this pandemic for the greater good, the social workers and the therapists, varying types that I'm sure that the footprint of Baylor will continue to get bigger as we evaluate the BU response to the pandemic across all areas.
Yeah, I believe it as well. Listen, Dr. Cotter, I know you're very, very busy, so I just wanted to leave you with one more question. Obviously the Baylor community is praying for you, praying for all of our nursing students and alumni and such. Well, what else beyond the prayers that we're sending your way? What else can be done directly to support the nursing program at this time?
I thought about that. I've thought about that question for the last few days. And as you know, our nursing campus is located in Dallas. It's a very different demographic than the Waco campus in terms of just density of population and demographics. For specific prayers, I guess, safety of our students as they're in this densely populated area, safety as we go forward into these clinical settings in the fall semester. We don't know what we'll encounter, what kind of care provision will be taking place, where will COVID-19 be in September, just the unknowns. And then trying to balance good clinical experiences for our students with not exposing them to undue risk, and praying for wisdom for our faculty as we're making those decisions of how do we navigate this uncertainty of the healthcare world to facilitate this Baylor education amongst the chaos of our healthcare delivery system. And it's just, as far as specific things to support, prayer is certainly very important, but those are some very specific things that you can pray for us. And certainly we've appreciated the support that our students have gotten financially through the President's Fund and things like that to help them get computer access, computer replacements, things like that, because when you're in an online course and you have a computer that's not working, so we've been able to do that with some of the funds that are there too. So, but it's been, as I've thought about that, I wish I had a more specific request, but those prayer items specifically for safety of our students, and then our wisdom of weighing the risk to the students and putting them in the clinical setting.
Yeah, that's great. And I know that those that I work with and those around the Baylor family certainly will keep you all in their prayers. And I'm glad you mentioned the President's Excellence Fund as well. If anybody tuning into the video is interested in giving to that, it directly does support students across the board. Just go to baylor.edu/give and you'll find a link to that President Excellence Fund. Great way to support financially if you have the means to do so right now. So again, she is Dr. Karen Cotter, the Associate Dean for Pre-Licensure Programs and a Clinical Assistant Professor in the Louise Herrington School of Nursing. Dr. Cotter, I really appreciate your time.
Okay, thank you so much.
And appreciate everybody else that took the time to tune in, and we will continue producing these videos as we all get through the coronavirus pandemic.